YouTube, it's your girl Sonia. I'm back with another video. Sorry for the long um, intermissions in between, but you know how it is living with a chronic illness, right? So today we want to talk about, and this is a very important video, especially if you take some type of narcotic, opiates, pain medication. I'm speaking directly to you right now. We're going to talk about if you have to go into a hospital and you are in pain. Now, there's some backstory to this, what our topic of discussion is today, because according to the New York Times, that a lot of the FDA is now cracking down on people who take narcotic opiate medication, especially those that has a hydrocodone in it, which is like Vicodin or something like that. Because of this, doctors are losing their licenses. They are facing malpractice. Opiates are a huge problem in this country. They just are. And during a crackdown, everyone pretty much wants the drugs to get off the streets and their loved ones to stop dying of overdoses. And that's understandable and that's wonderful. But when things are clamped down upon and when things come to a head, the people that benefit the most are more likely to fall through the cracks. Yes, other people will probably be helped at some point by making opiates harder for people to have in contact with, but they also happen to harm the people that the drug is there for. And what I wanted to speak about today is when you're chronically ill, and if you don't mind, I'm going to eat my favorite Andes mints while we're doing this video, and I'm going to try to make it real quick. This is what, and I've been in a hospital a lot, you guys know that if you follow me. I've seen so many people do so many dumb things, and it brings suspicion onto themselves when you go into a hospital and act a certain way. Let me tell you something. The minute you go into a hospital and they ask you what medication you're on, and if you have any type of opiate on that list, they're going to look at you like, okay. Especially the doctor. They're going to say, why? And they want to hear a damn good reason as to why you were prescribed an opiate and who prescribed. You're going to have a lot of questions for you. And you should always answer openly and honestly to the doctor because you're the one in pain. And because of this crackdown, doctors aren't really going to take any chances, especially if they don't know you. Okay? So the first thing you should do is when you're in pain and you're in a hospital and you are probably in need of some type of pain medication. Now, doctors like to play it safe by giving you like a anti-inflammatory, like a Toradol, something like that, and they work fine for pain, but always go with what the doctor suggested at first. So if the doctor wants to give you ibuprofen, go with that. You want to be cooperative, okay? If the ibuprofen or whatever they give you does not work, give it some time. Don't call the doctor in 10 minutes later. Now, let me make this clear. This is not a video on how to score opiates in a hospital. This is for people who are in severe pain and who get denied. They get denied because of bad people that go in a hospital and and they've burned doctors before and told doctors that they've been in pain and they are not. They're addicts. And this is not to bash addicts either, but this video isn't for you. This is for chronically ill people. The second thing you should do is never, ever, ever tell a doctor specifically the drug you want. I was in a hospital once and this young lady, I don't know if she was BSing or not, but I'm thinking more so she was than not, but she came in and was like, "Oh, well, can I get Dilaudid?" And I'm on the other side of the room, practically just wanting to scream at her, like, "What are you doing?" If you are in pain, because her foot was swollen really bad, so I'm pretty sure she was in pain. But she kind of gave off the vibe that she was a druggie or an addict. I really couldn't tell. But instantly she was met with aversion and she was met with suspicion, like, well, why that drug? And I'll tell you this one time. If they don't know you, the one thing you asked for is probably the one thing you're not gonna get. You tell the doctors and the nurses what your symptom is. You don't go in and say, let me get a Valium. Okay? You go in and say, I'm having anxiety or something of that nature, and you have the doctor make the medical decision. Again, being cooperative. If that doesn't work, then you need to let the doctor know, but don't ever tell a doctor or a nurse specifically, this is the drug that you want, because I can guarantee you 9 times out of 10, you're not going to get it. And you look like you are showing off drug-seeking behavior. And that's just the truth. Be honest. Chances are that if a doctor has already become suspicious of you, they may run a toxicology screen. And anything that you've done will show up. So if I know people that like to potentiate their opiates with other drugs. With potentiate means to make something stronger. If you've done cocaine, if you shot up heroin, or if you smoked a joint, you need to be honest and let a doctor know that yes, you have done some type of illegal substance. Because if they run a toxicology screen, I guarantee you're going to be sitting there with Tylenol, ibuprofen, and the doctor will be well within his right to do so because of your past behavior and the fact that you lied. If you are under a pain management doctor's care, then always have his name and phone number at the ready. And I say that because, again, doctors are they're just going to be very suspicious. And that's just the way it is now. And it's important that if you are in pain and you are under the care of a pain management doctor, that you have his information, because they may want to ask or verify that information over the medication and the dosages that you're on. It's also important that you know all the medications that you take. So it's good to have apps. Like I have my my iPad here, and I keep all my my apps in all my medication in this wonderful app called Pillboxy. And I keep all the correct dosages and when I'm supposed to take them, and it just creates less confusion for the doctors and the nurses. Not last. The next one is, if you don't have a doctor, or if you're not under the care of a pain management doctor, then this is the time to go look. And trust me, it's not easy, because I still haven't found one. But I have a physician that treats me for my conditions, and I'm happy. But I don't have a pain management doctor per se, because of how my insurance is. But that is very important, because you do need to have somebody to monitor your usage. You need you may have to sign contracts. If you need to switch to another medication, or even come down off your medication, it's kind of dangerous to try to come down off your medication on your own. Okay? And the last thing you should do is, if you're having trouble in a hospital and for whatever reason you have already given them reason to be suspicious, or they're just a suspicious lot anyway, or you need to call for a patient advocate, and most hospitals have a patient advocate in the hospital. And they will speak on your behalf with your team of doctors and to figure out a plan for you. Now, I have taken things all the way to the state of Indiana on some physicians because of how I was treated in a hospital because my pain wasn't managed adequately for obvious reasons. I was in a lot of pain and doctors were just not understanding that. There's some doctors that don't even believe in giving patients pain medication unless they're like in surgery or had surgery. And to those doctors, I just don't understand. Maybe they've never been in pain or severe pain. And when you're in pain, it's important to have your pain managed because it shortens your life. And if you're in pain all the time, you're not having a great quality of life. And I dealt with that for so long. So long. And now that I am being treated, I do have a better quality of life now. Things could be better, but I can't complain because I am able to treat my pain. But there are people out there that suffer. So, again, I just wanted to do a quick video on what to do if you're in a hospital and what not to do. And you're in pain and the doctors are giving you a hard time, just remember all of these things. Refer to this video as a reference, and I will talk to you guys later. Thanks for tuning in. Please subscribe or check out my Diary of a Sick Chick on Amazon.com. See you guys later.